All right, let me get my slides. Here we go. Excellent. So, as I said, we're looking at migraine today, and this is a bit personal to me because actually, migraines was part of my transition into changing how I approach medicine. So, I'm going to share a little bit about my story and my approach, and then explore a kind of pathway to recovery. Now, this is only for educational purposes, this presentation. Please, if you have a headache that you're worried about, please do consult your doctor. Don't assume that you have migraine. And if you've had migraines and your migraines have changed, or if you develop a new headache later in life, or if you have headaches that are worse in the morning, do speak to a doctor. I know here in the UK, it's a challenge speaking to GPs at the moment, but it's worth pushing on through and having a conversation just to make sure nothing's being missed. So please don't take this as an alternative to, at least having a chat and getting a diagnosis with your doctor. So let's take a little roadmap through where we're going to go today. So we're going to talk about my story. We're going to have a little definition about what migraine is. We're going to ask the question, is medication the only answer? And we're going to look at how I approach migraines now and managing migraines. And at the end, we'll have our question and answer session. Just before I go on to tell my story, I do want to say somebody made a comment today on my social media that made me think that I'm really anti-medication, and I'm not. And I actually are able to kind of sit in both worlds with my conventional training as a GP and with my lifestyle medicine and my functional medicine training too. And actually, I spent many years working in Africa in different sort of war zones. And, I remember the first time a baby died of tetanus, which, we vaccinate against. I remember the first time a child died of diarrhea, the first time a child died of a lung infection that could have been treated with antibiotics, and on and on. And so I really value what we do as in the NHS, and I value that there is a place for medication. And nothing I'm saying is to condemn anybody that's gone down the medical route. Everything I'm talking about could be done as an adjunct to your therapy. The wonderful thing about exploring lifestyle as a way to get us better is often nearly all the time, it does no harm. So yes, do hear me in the context of how I do value the NHS. And for those that are new today, so I've been a medical doctor for 22 years. I trained as a GP. And about halfway through my career, I got really sick of just treating diseases and not people. And I felt more like a pharmaceutical vending machine than I did a doctor, and with a heavy sort of emphasis on disease management and prescribing, never really feeling like I was getting to the root of anything, sort of 10 minutes at a time with a patient and no continuity of care. And as I'll go on to tell my story, it was the tipping point for me to look at a different way of doing medicine. And now I have a small clinic. I speak regularly on BBC Radio, and I'm a wellness advisor to the wonderful Michelin-starred Hampton Manor, as well as places like the British Army. And I've started developing online courses in a desire to put tools into your hands and give you agency over your health. So that's what I'm doing at the moment, and that's why I'm doing this. It's my heart and passion. I fell back in love with medicine when I discovered this way of doing medicine. So let me tell you a little bit of my story with migraine. Probably goes back, I've got 3 girls, and I had my first one in 2005. We were out in Uganda at the time, having just had a stint in Sudan. And I had a really difficult birth in Uganda, and developed postnatal depression. And on reflection, I actually think I was starting to have problems back then it related to migraine, but I just didn't see it. And I wasn't a very good patient and didn't get any medical care. And then I went on to have a second child. We moved back to this country when she was quite young, and I got another quite severe bout of depression again. Postnatal depression. Having my third, we did things very differently as a family and wrapped around a lot of care and support after having her. And pleased to say I didn't suffer with postnatal depression then. After our third child, we moved house. I was working as an inner city GP, which I loved. Like, I just loved my patients, loved the diversity. We lived on the housing estate. Our kids were educated there, and it was a real rich time in my life. But I just started noticing a whole host of things where I thought it was just like my depression hanging around or coming back. And in a way, I'm one of the people that don't particularly get bad headaches when I get migraine. And I started to get a lot of weird symptoms, you know, crawling feelings on my skin. I would have incredible difficulty word finding. I would suddenly not be able to remember my best friend's name. And terrible issues with energy. But then I would have great days for a couple of days and feel completely normal. But this was sort of going on, and it was happening, you know, a few days a week. And, you know, I went to my doctor. I hated going because I couldn't work out what was wrong with myself. And we did some blood tests, and, you know, at the time he said it was all normal. Very interesting. Now I've learned what I've learned. I look back and my blood results were not normal. And if there are other medics here, one of my things around how we interpret blood results is that we look at a population norm, which doesn't mean that's normal for that person. And I look back and I had an iron of sort of 15, and my iron usually runs, well, ferritin of 15, and my iron and ferritin usually runs at about 70 or 80, and that wasn't normal for me, and that was contributing to some of my symptoms. And so anyway, yes, I was going, you know, backwards and forwards to the doctors. I changed my job, reduced my hours. I lost my baby weight. I'd gone back to the gym. I thought I was eating a healthy diet, but back then I kind of ascribed to, you know, this whole low fat movement and reducing calories, and had no idea about nutrition. We get no training as doctors. And so, but just kept getting told like, oh, there's nothing wrong. And so I thought I was going a bit mad, if I'm really honest. And I was starting to get a lot of pressure in my head and a little bit of visual disturbance that's more classic with migraine. And then I remember one September being at the gym, and I couldn't coordinate my legs anymore on the treadmill. It was really scary. I could have managed to walk, but I just, all my focus to try and make my legs do what they needed to do. And I went back to my GP and I said, this isn't normal. Like, I want to go and see a neurologist, like something's wrong. And there was a discussion about whether I had multiple sclerosis, but it didn't really fit that. And thank goodness for the NHS. Like, I had wonderful, you know, the scans that I needed and the tests that I needed. And at the end of it, my neurologist decided I had chronic migraine without the headaches, this chronic aura, which, you know, I've been trained for 12 years by then. I had no idea that even existed. And so, you know, got put on various medications. And my third trip back, having not been able to tolerate what they'd put me on, I had a moment with my neurologist where I was like, is there anything I can do, like, to get myself better? Like, I don't feel you're telling me what's wrong with me. And he just slipped another prescription across the desk for an anti-epileptic that's often used for chronic migraine, and said, Sally, take this and come back in 3 months. And I walked out, and it was the tipping point for me. You know, there was all that frustration anyway with my job. And then I thought, no, there has to be a better way. And that was the point where I went back to the books, and I thought, well, what does my body need? And I, you know, educated in nutrition, and I changed so much from when I had trained in the 90s. And you know, and oh, whoops, hello. And you know, sleep science had changed radically, like our understanding of stress, our understanding of the gut microbiome. And I mean, the science is just beautiful and stunning and wonderful. And what I became convinced of is that our bodies are wired to heal. And we just need to create an environment around our genes that taps into that innate biological brilliance. And for those of you that know, out of that time, you know, I developed a 5 foundation approach, looking at sleep, movement, rest, and connection as a framework to kind of guide people back to health. But in my own story, like initially, I had no idea what I was doing. I was reading papers left, right, and centre, and you know, doing courses over in America, and I got myself better very quickly. Now, how I got better, you know, I don't think is really important, because there's no one size fits all for everybody. And this is my problem with modern day medicine. You know, we treat diseases, we don't treat people. I radically changed the way I ate, and redefined what I consider healthy. And as well as other things, you know, really aggressively pursued getting my sleep back, having had young children. And yeah, and also for me, a big part of it was I started to prioritize self-care. And I don't know about you, the first sort of half of my life, well, probably 2/3 of my life, I'd spent, you know, trying to be a good daughter, trying to be a good mum, good wife, you know, always pleasing other people, but never putting myself first. And as a result, I hadn't got some things in place that were important for me in looking after myself and becoming the best version of myself, so I could actually be a good mum and a good wife. And well, I don't know whether I am a good wife, but I try and be a good mum. So anyway, so that was sort of, you know, a tipping point for me, was recovering my own health. Which has led to where I am now. I fell back in love with medicine. I found a way to help people, to personalize care. You know, I'm not a miracle worker. I can't get everything better, but one of the things I love about what I do is it can be an adjunct to therapy, and all that I do, you know, will only help improve someone's health alongside, you know, conventional therapy. And I still use conventional medicine, and there's a time for it. So brilliant. That's a little bit of my story, and let's talk about migraine. So just by definition, you know, the definition is usually a moderate to severe headache. It's usually a throbbing pain. It's usually on one side of the head. People often feel nauseous or are sick. They're very sensitive to light and sound. And migraine is really common. Like, it's affecting 1 in 5 women and 1 in 15 men. The reason it's more common in women is that when we have estrogen dominant conditions, estrogen can be a driver in the migraine story. Aura, what I mentioned and what I really struggled with for those years, is described as any neurological disturbance. So neurological just means something that affects the nervous system. So that might be, some people present with like paralysis, like a stroke. It's really scary. I remember the first time being in A&E and having a young 22-year-old come in with what looked like a stroke, and thank goodness it turned out to be a migraine. But yes, so it can be weakness, it can be loss of speech, loss of cognitive function, it can be you know, sensory disturbances. One of the first things that goes for me is often my hearing actually changes the pitch. It's the weirdest thing, and a slight change in sensation in my head. And yes, you can have migraine aura without the associated headache, which what was happening with me. Chronic migraines are defined when you have 15 days per month, but anybody who is on this call knows that, yeah, it's 15 days of having the headache, but the next day can be just as awful. You feel like you've been hit by a bus and you're walking through treacle, and things are just not functioning that day after. And some people, you know, it takes more than a day, you know, a couple of days to recover. And I think for me, the reason that I don't believe that our medical approach works for migraine is because there isn't one cause. And actually, I've really put off talking about migraine, if I'm honest. I've had a lot of people asking me to talk about it, and I get worried because there's quite a few like little rabbit holes you can go down, and it can be quite time consuming working out what's going on. And I'd hate to think at the end of this you just think, oh, I don't know where to start. Like, you know, she said so much and I'm not sure that's helped. So I'm going to try and bring it to some helpful tips of where you could start. But even when I have people who come in with migraine into clinic, in my private clinic, is complex, and it takes time. It takes a lot of listening to story, and partly one of the reasons is there aren't particular tests for the things that we're going to discuss that really highlights where the issue is. And I always say, like a lot of brain things, it's a bit like a calendar, you know. So there's just lots of holes that could be causing it. And actually with migraine, you know, sometimes, you know, there's a tipping point. So, you know, and sometimes you're okay, you know, drinking that glass of red wine, but when you're sleep deprived and when you've also had a bit of cheese earlier, and you've just had an argument with the spouse, there's this tipping point that tips you into migraine. And so often, you know, it's not just one thing, it's trying to manage, you know, a few things, but I'm hoping this will give you some tools going forward. And the downfall with, you know, a lot of medication is that it's often just focusing on one pathway. But if there's lots of things going on, that doesn't always often, you know, offer a cure. And there's medications that treat, so simple things like your paracetamol and your codeine and maybe some anti-sickness tablets. You know, and then going on to things like your triptans, and then you've got, you know, medications where you're getting them so often that they're prophylaxis. Oh, just pop yourself on mute, that'd be great. And they're things like your amitriptyline and your beta blockers, and then you get onto gabapentin or pregabalin or topiramate, and all of these medications, you know, have side effects. But the downfall is they're just looking at one, you know, pathway that they're blocking. And as I said, there's often a few things going on with migraine. And I think the good thing is you don't have to get it all right, you know, but you do have to understand what some of your triggers are. So as with everything that I say, and those that have been following me for a while will know these 5 foundations, like, and I'll be doing something on sleep soon. Like, sleep is super healing, you know, and the first thing to get into place if you're struggling with recurrent migraines is reestablishing a good sleep pattern and getting good quality sleep. You know, stress, you know, really puts a lot of stress and strain, you know, on our bodies, and the opposite to that is we have a rest and repair system. And if we're constantly in that stress zone and we don't know how to close the stress cycle, that also is going to really put us in a place to be triggered by other you know, other triggers that may feed into the migraine story for us. And stress can really give us a leaky gut and upset our gut microbiome, as sleep deprivation does as well. You know, movement is wonderful for, you know, our whole health, switches on so many amazing pathways in our body. You know, has its own endorphins, which act as painkillers in themselves, so are a wonderful part of resolution. You know, social isolation is highly stressful to us. We're social beings, and that need to be connected can also be a part of recovery. And then the nutrition piece, which again we will touch on a little bit later. But often with migraine, you need to hunt a little bit harder. And it's one of the, well, I try to listen to everybody's story, but you really do need to listen to story here. And I'm going to just take you through some of the thoughts that I think are often contributing to the migraine story. We were going to touch on food allergies and intolerances. We're going to look at chemical triggers, particularly chemicals in foods, touching on hormonal imbalance, magnesium deficiency, B2 deficiency, and then at the end we will discuss this issue around histamine intolerance, which is complex too, but needs to be touched on because it's often missed. Brilliant. So, oh yes, and medication overuse also we'll touch on as well. So food allergy and intolerance is a huge topic. And when I do my gut health course, we do a whole hour on that. And even then I'm just, you know, just scratching at the surface. And that's partly because we have a particular type of allergy response in our immune system called IgE, which is really easy to know whether you have an issue because you get immediate symptoms, and we have great tests for it. And as conventional medics, we're really happy with knowing what that is and how to manage that, although managing is avoidance, but it's something we're familiar with. But there are other types of allergies that are less well understood and the testing isn't as good. So non-IgE type of allergies, or IgG, and then just this whole thing where it's nothing to do with our immune system. There just seems to be an intolerance. So when looking at food allergies, we can end up down a sort of rabbit hole. And it is one of the things that I think, let me just get the book, if it's a route you want to go down, it's an area I'd probably get help with and get some input of how to do that well. I will give you the headlines of how to do it well. But I do love Megan Ross's book, which is Eat Yourself Healthy. She's not a doctor, she's a nutritionist. I think she's a nutritionist or biochemist. But this is all about gut health. And she has some pages focused very sensibly on how to identify food allergies, that I think is very clear and very helpful resource if you think that's the thing that's contributing. Now, so the most common allergies, if you look at the UK allergy website, is gluten and dairy. So gluten is a protein found in wheat, barley and rye. And it's nothing to do with celiac disease, which is an autoimmune disease. It is implicated in leaky gut, and there is something called non-celiac gluten intolerance, which is becoming more accepted, which can manifest in headaches and aches and pains and lack of energy. Now, I love dairy. I'm pro dairy. Beautiful, nutrient dense food, especially when it's produced correctly and farmed well. But when you're looking at removing foods, one of the other reasons that it's tricky is that you can react to a food that you ate 3 days before. And that's why it's really tricky. There's some allergies, the ones that you react to immediately, it's really easy, and actually you don't really need a test because somebody walks in and they tell you, I eat this and I go red, but a lot of these other sort of non-IgE sort of allergies or intolerances can take up to 3 days before you have that immune response. And that's why it is so difficult to identify triggers. And the other thing is, as I said, there aren't particularly good validated tests. A lot of my functional medicine colleagues will use IgG testing, but it's not validated in this country, and I use them with caution. They can make people really neurotic, thinking they're allergic to all sorts of food and really restrict their diet. So they need to be handled with wisdom and with the right understanding of how to use them. And then the big thing, I think, to remember when you are doing an elimination is, one, you need to remove it out of your diet in all forms for 3 weeks, especially if it's this IgG mediated kind of response, because it takes that long for your immune system to actually, calm down. And then you remove it completely, you record your symptoms, and then you reintroduce. This is the thing that everybody fails, well, not everybody, a lot of people fail to do. They think, oh, I feel a bit better, I'm never going to eat gluten, and then, oh, I'll just have a bit, and then you never establish whether it's an issue. So what you do, and if you can do it blind, where somebody sneaks it into your food, even better, you reintroduce it to establish whether that food is an issue for you. And then remembering that it can be 3 days until you have a reaction. So bearing that in mind. And so I talk about the 3 R's. So remove, record, and reintroduce. And then also another good resource is allergyuk.org, if you feel this is one of the things contributing to your migraine. Brilliant. Chemical triggers. So commonly, maybe that's a bit, there's good stuff in the research for all of these. So aspartame, which is an artificial sweetener, MSG, often used in Asian food, and nitrates used in like processed meats, sulfates often found in wine and dried fruit, and drink concentrates like your orange squash, and tyramine, which also is found in chocolate and cheese. And again, there's not particular tests for these. My heart is to get people off processed food and onto real food. And in the process of doing that, you often eliminate a lot of these. And as I said, often it's a tipping point. It's not You know, it's not just that one glass of wine, it's the wine with the chocolate and the stress and the lack of sleep, and it triggers, probably, you know, through oxidative stress, which is a process in your body. Yeah, those can be helpful when thinking about, you know, am I having a reaction? And usually these ones you would have a reaction within sort of 30 minutes of eating them. It's unlike those other food intolerances. Hormone imbalance is a big one. And when I'm listening to story, if you particularly get worse, so for women, worse cyclical migraines, you know, so you're getting before your period, or, you know, or you're getting them just before your period. And especially if you have other estrogen dominant conditions, like if you're on the oral contraceptive pill, you need to go and talk to your doctor if you're having migraine, and or it's quite a significant risk factor. You shouldn't be on that. You can be on it sometimes just with migraine. And then conditions like PCOS. When we get more obese, our fat cells take our testosterone and they make estrogen, and therefore makes us more estrogen dominant. You know, irregular periods are often associated with a lack of progesterone, which makes us estrogen dominant. And the solution there is not to treat the headache. The solution there is to support your hormones and bring some balance. And that's done. Well, actually, you need to come on my course. I'm doing a 6-week one on balancing your hormones. It's a beautiful course. But really, that's where you need to go if you've got cyclical hormones. And sometimes actually treating with a bit of progesterone to make that gap can be really helpful premenstrually. And I often use a bioidentical hormone, progesterone, in that case. But on the whole, I wouldn't go straight there. I would look at eating. I would look at supporting detoxification. I'd make sure they're having a good poo, because when you're constipated, you start recycling your estrogen. And I've done 3 talks on hormones. It was supposed to be 2, but many of you know I messed up on one of them and locked you all out of my room. But anyway, and if that is you and you haven't watched them, do just email me. Well, actually email Francesca and she'll send you the links to those talks, because they can help you unpack that. But as I said, in May, I'm doing a course on balancing your hormones. You know, you might want to sign up. We've got a few places left on that, and come and do 6 weeks. It's online, once a week for an hour, but that might be of interest to you. Something that I think is really useful and often overlooked by many of my colleagues is looking at magnesium and B vitamin deficiencies. So magnesium, it's involved in about 300 different processes in your body, and particularly, you know, if you've got migraines but you also get cramping, if you're getting more anxiety, if you're having trouble sleeping, that can all fit with magnesium deficiency. We measure red cell magnesium and it's not particularly helpful. So if I had somebody with all those symptoms, but even a normal magnesium, I would still consider adding in magnesium. And one of the reasons we have a problem is that it's just not in our food anymore because of how we're treating our soils, and killing off their bacteria in the soil means that, you know, the plants can't get some of these micronutrients, and therefore it's not in the food chain. But you do get it in seeds and nuts. And I've put here, if you want to have a go at supplementing with magnesium, you know, I recommend sort of 300 to 600 milligrams twice a day. Be careful with magnesium. You can't really overdose unless you have severe kidney disease. You need to talk to your physician. But outside of that, it's fairly safe. You'll know you don't tolerate it because it can give you loose stools and give you diarrhea. So then either cut down the dose, or try a different magnesium salt, or get a topical magnesium. And then the other thing that there is B2, riboflavin. Which again is more difficult to measure. You can do it in the functional medicine world by looking at organic acids, but again, it can be worth trying to supplement with it, particularly if you are vegan or vegetarian. it's more difficult for you to get B2 because predominantly it's found in dairy and meat and fish. You do get it in, your spinach and your yeasts and fortified cereals, and even quinoa or quinoa, however we're saying it. But in plant-based foods, often it's difficult for you to extract it and get it into your body. Fermenting these things can help. But it's another thing that sometimes, just trying it at the dose I suggest can be helpful in preventing migraines and getting the testing if you can. As I said, do remember often there's a tipping point with these things, and sometimes just thinking of that calendar, as you plug some of the holes, it's enough to prevent migraine. And you don't have to do all of those things. I'm not suggesting that all of those things are a problem, but trying to identify triggers can be really helpful in management. And I do think as well, like some of the theory behind migraine is this thing called oxidative stress. So what that is any engine has byproducts, so if you drive a car, you've got your exhaust and you've got heat, and our own engines have inefficiencies and they have byproducts, and they produce these little things called free radicals. And our natural way to manage that is through our diet. We have antioxidants, A and E and C, and they mop that up. They catch those little free radicals and calm it all down. And there's some studies that suggest that actually migraine is that tipping point where you haven't got enough antioxidants and you've got this oxidative stress building up for whatever reason. And therefore, way before we think about maybe doing any of this, getting onto a whole food diet, getting lots of fresh fruit and vegetables into your diet can be really helpful. As well as we know, I've talked loads about this, your gut microbiome, your gut bacteria are really important for our health, and they love fiber, they love eating the rainbow, they love eating, and they love whole foods. They thrive on quality, meat products and veg products. Having that plant slant is important, but simply sometimes shifting away from processed food and getting onto whole food and really building up those antioxidants can be all that you need way before you start doing any of this other stuff. I want to mention histamine intolerance. So I really feel for people who have issues with histamine, because I think on average it takes 10 years for people to get a diagnosis. They've usually seen so many doctors. So histamine's a natural organic nitrogen that we have as part of our immune system. It's in our mast cells, and it does some wonderful jobs in terms of keeping us healthy and our immune system and sleep and allergy, and so it's really useful. And but it appears that histamine intolerance from having too much histamine in our diet can trigger and be part of the migraine story. I don't go here until I've sorted out all those other things. And the difficult thing is it's a very difficult diagnosis to make. There are no tests. You can measure certain enzymes, your DAO or DOA, but it's, they vary wildly, so it's not particularly helpful. You can measure histamine, but again, that varies wildly. And so often, the reason that it's such a delayed diagnosis is, people have tried everything else. And certainly it's not usually in the conventional medical world that they get this diagnosis. But it can be a real lifesaver actually once you hit upon it. And especially you've got headaches that are also mixed with allergies and gut issues, you do start thinking, and you've tried those other things and those other exclusion diets, and you've nailed sleep and stress and nutrition, and you've looked at those vitamin deficiencies. If we're still getting this, I'm thinking histamine. And histamine foods high in histamine are like your red wine, your fermented foods, citrus fruits, seafoods, eggs, all wonderful things. My goodness, none of those are awful foods. And again, it's a tipping point with histamine intolerance. It's not that you have to remove all of those foods from your diet. Life would be miserable. Histamine's in so many foods. But you do have to work out what your personal tolerance is. And yes, as I've said, there's a tipping point, and actually going on a low histamine diet can make the diagnoses. And if you're one of those people that you've tried all these things and you're really desperate, this is a wonderful resource that I came across. She's amazing, and super helpful in terms of how to do a low histamine diet, super helpful with lots of really good information. Really lovely. And so for those that have suffered for a long time, you feel like you've done the magnesium, the B2, you've tried elimination diets, you're managing your stress and your sleep, and you just don't feel you're getting anywhere. It might be either time to see somebody that has this kind of experience, and I wouldn't consider myself experienced enough in this. I would refer somebody on, to get some more experienced help. But just to put that out there for you. Then finally, just a note on medication overuse. So medication in themselves, all sorts of medications, you get out that list and have a look at the side effects. Often headaches and migraines can be part of that. So particularly if you've got migraines that have started since starting a medication, it's worth going back to that prescriber to explain what's happening, to see whether, you need a different medication. But there is something called medication overuse, where it doesn't particularly it can feed into the headache cycle, and that's the overuse of paracetamol and opiates like your codeine, your tramadol, your morphine. Actually, if you're using that regularly, for headaches, they can actually end up causing headaches. Very difficult to break the cycle, and something that actually conventional medics are very aware of, and your own GP could maybe help wean you off and see if that's an issue. Excellent. So I just want to share this with you. This is I use this all the time with my patients in my own life. It's just a wheel of life. And on each of those spokes is one of my foundations. And I've split connection into connection with self, connection with others, and connection with purpose. And you use this and you have a scoring system. You put a 0 in the middle at the center of the wheel, and you put a 10 on the outside, and you score yourself. And it's like you look at each foundation and you're like, how am I doing? If you're doing brilliantly, you get a 10 right out there on the circumference of the circle. If you're doing awful, your dot sitting right in the middle. Now, this is me scoring it was about 4 weeks ago. Well, 5 weeks ago, I was super stressed. My daughter was in and out of hospital, and my husband had broken his ribs, and the kids were off school for half term, having only just gone back. And so this is me having a look of like, what's going on? Like I've got a migraine, something's out of whack. And what I've learned with my migraines, I've really learned to befriend them. I hate them and I can't function properly, and they're so frustrating. But they, to me, are my body telling me that something's out of whack and that I need to pay attention. Your body will always get the final say. And so for me at that time was stress was, a massive issue. It wasn't, that's the rest bit. I wasn't managing it well because my husband wasn't driving and doing anything. I didn't get out to get my runs, and that's a real relief for me, running and getting into nature and connecting. And I just hadn't had any time to connect with myself. I was doing all right on the sleep bit. I was all right with connection with others, and I have a great sense of purpose at the moment doing this. And my food bit was fine. And so for me, it gives me an idea of, gosh, where shall I start? And this could be really helpful, just taking a moment, and scoring yourself, because it can seem so overwhelming when you're trying to make lifestyle changes. And then these are all resources available on my website. Say nutrition piece is an issue. You can go through these 8 principles and see, like, have I got all this in place? Or do I need to work a bit better? You can get my sleep hygiene if sleep's an issue and go, do you know what? I need to revisit my sleep hygiene and really get on top of that. I've got a sleep pathway coming up. You could come and attend that. How's my stress management? These are some of the ways I manage my stress: get off my device, have a good cry, get back into nature, go for a run, process with a friend, do some breathing, have a hug, and actually having your own little sheet of what fills you up, what helps you close the stress cycle is really useful. It's useful having it somewhere, because when we're in the moment, we forget and can feel sorry for, well, I can feel sorry for myself. Brilliant. And then, as I said, like, prioritizing self-care is the thing. Like, I think we're just so poor at it. And, you know, we need to, I have a little practice at the beginning of each week. It takes me 3 minutes now, probably. It used to take me 15, where I sit and I look at my week and I put into my diary the big boulders that I need. And for me, I have to prioritize my running. I have to prioritize shopping and food planning. Otherwise, it all goes out the window. And, you know, I have to prioritize alone time. I'm deeply introverted. It took me years to accept this. I was raised in a massively extroverted family, thought there was something wrong with me for most of my life. And what I've come to realize is actually, no, I just need time on my own. I love people, but I need to balance by taking that time. And I have to put that in my diary. And then everything else has to fit around that: my work, my kids, my husband. But in a way, they're happy because I'm a better version of myself and more productive. And they're those things that just don't get done, those people that get offended. And I just have to drop those balls at the expense of my own health. Brilliant. So do come on my my hormone course. That shouldn't have been in there, but yeah, just to summarize, let me put all these up. It should have come up as one. My error. These are kind of probably where I would start. You know, if you're feeling so overwhelmed with that, you know, initially just look at removing some processed food out of your diet and just getting back to whole food again. Maybe this week it's just adding an extra vegetable to your plate every night. That's it. Just do that. You know, prioritizing sleep and stress management. And then start after that, if you've really nailed that and migraines are still persistent, start exploring the allergy or the intolerance thing using the 3 R's approach. Whoops. I would add in magnesium and B2. You know, it's a real easy thing to do. Oh my goodness, Sally Bell. Let's do that again. No, one more. Yes. Okay. And you might, or, you know, if you're not a fish eater, you know, I would look at having a fish oil in there as well. It's very anti-inflammatory, really balance that inflammatory issue going on in our body. If you're a vegan, you can get that from sea algae. What you really want is the EPA and DHA, not omega-3 from walnuts or flaxseed. We find it really difficult. We only actually convert about 5 to 20% of that. So you need EPA and DHA. And then CoQ10 also is coming up in quite a bit of research around migraines too. That's really involved in our mitochondrial function, our energy function, especially if you're on a statin, a cholesterol tablet. CoQ10 is probably quite important for you. Yes, and then do come on my hormone course. And I think with lifestyle as well, just, you know, finding a tribe. You know, there's some wonderful research that shows one of the best predictors of health and longevity is having a healthy friend. And so, you know, do keep in touch with me. The best place to find me is on Instagram. My handle's Dr. Sally Bell. Don't forget my online course. I do lots of others, happy gut and weight loss, and I've got a lovely cancer recovery one coming up in a couple of weeks too. But I'm quite excited for this one. I like it when, I love the men, don't take any offense, but I do like it when I get the ladies together. I'm also just taking on the role as wellness advisor at the wonderful Michelin-starred Hampton Manor, which is near Solihull in the Midlands, and we're designing retreats. We did this before lockdown. They were just wonderful. It's in a stunning setting, and we take over the whole cottage. The rooms are stunning. It's got a walled garden. Everything's organically grown. They love their food, and actually during the retreats you'll get the opportunity to do some stuff with the chefs and the bakers there, as well as me, and talk about health. So again, look out for that if you're interested. If you're not on my newsletter, just message me now on the chat directly with your email address, and we'll add you on so that you can keep up to date with those events. But fab, you've been amazing. So let's just get rid of my slides down here so I can see your lovely faces, and it's time for any questions.
Grab a glass of water?
Oh yes.
I'll let you grab some water while
I get a migraine.
Right, there's been a couple of questions. They would like to know the relationship with menopause and hormones. I know that you covered it quite a bit.
So on the whole, migraines tend to get better post-menopause, so after the menopause, because the link hormonally tends to be either a progesterone deficiency or an estrogen dominance. So post-menopause, when your ovaries have stopped producing both of those hormones and we only have a little of it coming from other places, migraines tend to get better. However, we talked about this perimenopausal time, which is that transition period. And if you were on my talk, I showed you a picture of bungee jumper. And actually what's happening with our hormones are our ovaries one day are giving it all go, and then the next day they're kind of, oh no, I can't do it. And then, they're doing it again. And we have all of this going on in our body. And in amongst that, actually the first hormone to go is progesterone. And progesterone is our calming hormone, our anti-anxiety, our anti-bloating, and our